So hopefully you see the next slide here. This is just, I'm kind of going from the top down. Want people to ask themselves, when we talk about protocol pooling, POD, JIT, all these kind of concepts, are these truly new things, or is this evolutionary, in what we've been doing in clinical supplies for the last bunch of years? Are we reinventing the wheel? Or are we just continuing, progress? So as a pharmacist, I've worked retail, I've worked hospital, I've worked obviously a lot of years in industry, and I try to be very pragmatic and use common sense in what I do and try to solve the puzzle that we call clinical supplies. Years ago, we started doing a lot of IVRS, and now we call it IRT kind of projects. But even in the 1980s, basically when I had hair, so some of you knew me then, we did a lot of really kind of what we do with IRT systems, but we use fax machines. So a lot of the things we do aren't necessarily new. So we shouldn't be so really afraid of doing these things if we have the controls. And, we go to a lot of presentations and everyone gives things all cool, new names, but, just think about what you do at your companies, and maybe we shouldn't drink the Kool-Aid everywhere we go. Okay, next slide. Right, so ask yourself, is there a correct way or path for you to implement a program such as protocol pooling or using point of distribution or JIT programs at your company? So, think to yourself, what is your culture at your company? Are you a very conservative organization where you will need a lot of justification to implement new ideas or move forward? Are you at a big company, a small company? I know some of you, because I've seen some of the people sign up, are at consumer companies. Do you do a lot of investigator initiated trials at your company? All those things affect, how you might use some of the concepts we're going to talk about today. At Xcelience, I'm extremely fortunate to be here because the clinical supplies area at Xcelience is virtually new, a year and a half old, and all the people here are just totally energized and want to try new things. So it's kind of lucky for me. Okay. Are there universal rules to ask yourself? Can a global plan be used across all of your trials? Right. So maybe you're working on, you're going to focus on one compound, that you have a lot of trials going on for that compound, or in the future you're going to do that. Is there a way to look at those trials and find a way to do things much more efficiently, right? Is there more than a simple rule of thumb that you can do for these supplies and make things even more efficient, right? There's never, how do I say, there's always a newer way to make things more efficient when we're dealing with these supplies. We're not commercial, right? So in the commercial supply world, you're doing long runs repeatedly over and over and over again, right? Clinical supplies, we're doing the puzzle pieces, a lot of short runs, a lot of uniqueness. So how can we gain some efficiencies in what we do? So just keep asking yourself those questions. And now we're going to do some definitions. You may have your own definitions for these concepts. That's fine. I just need a baseline myself and a baseline, for the folks working here. So let's start with what is protocol pooling, right? So think of it as a strategic inventory control program or process that allows for the optimized usage of drug products at clinical sites by identifying their specificity to meet immediate clinical trial needs. Right? So the main idea here is, can we identify our clinical supplies further down the road? Can we move the identification of our materials later in the timeline and the clinical chain itself, right? To gain more efficiency. You know, currently most people are labeling their supplies with protocol numbers, you know, right at the time of packaging. If we can move that further down the chain or the time chain, we could maybe gain some efficiencies there. Point of distribution. For me, point of distribution is a process by which the application of a label presenting ancillary, supportive, or country-specific information can be performed at a step in the actions of the distribution of clinical supplies. So